Warning signs of liver cancer one must not ignore. The global incidence of liver cancer in 2020 was more than 9 lakh new cases, and liver cancer is the fifth deadliest cancer for males and the ninth deadliest cancer for the females. It's also a leading cause of cancer death globally, accounting for more than 7 lakh deaths each year. Moreover, incidence of liver cancer in the next 20 years is predicted to increase by more than 55% globally if the current rates do not change. This means that by 2040 there could be about 1.4 million new cases and 1.3 million deaths from liver cancer worldwide. The burden of liver cancer varies across different regions and countries, depending on the prevalence of the risk factors such as cirrhosis, chronic viral hepatitis, infestations of liver flukes, long term use of oral contraceptives, and smoking. Some of the factors that contribute to high mortality rate of the liver cancer are: first, late diagnosis. Many people with the liver cancer do not have symptoms until the disease is advanced, making it harder to treat effectively. Second, limited treatment options. Liver cancer is often resistant to chemotherapy and radiation therapy. Not all patients are eligible for surgery or liver transplantation. Third, high recurrence rate. Even after successful treatment, liver cancer can come back and spread to other parts of the body. Fourth, underlying liver disease. Many people with the liver cancer can also have chronic liver diseases such as cirrhosis or hepatitis, which can affect the overall health and survival. Liver cancer broadly classified as: first, primary liver cancer are tumors that develop directly from the liver tissue. The most common type is hepatocellular carcinoma HCC. Other types includes fibrolamellar HCC, cholangiocarcinoma, and angiosarcoma. Secondary or metastatic liver cancers are tumors that start in another part of the body, such as the colon, then spread to the liver. The liver cancer cells that spread are cells made in the organ original cancer location, for example.